The 8 positive cases are related to the same travel event. Through the public health investigation, we have now been in contact with all 21 Iowans who recently traveled as a group on the Egyptian cruise. As you already know, the 7 individuals who tested positive are recovering at home in isolation. The other 14 are also at home under quarantine and are being monitored by public health. 10 of those individuals have been tested for coronavirus and results are pending. Based on the Iowa Department of Public Health's investigation, we know that these individuals had limited interaction in their communities and they did not attend any large public events. So the potential risk to others is considered low. Of the 5 new cases that were announced yesterday, 4 were residents of Johnson County who traveled again on the Egyptian cruise. All 4 are older adults within an age range of 61 to 80 years. The 5th individual is a middle-aged adult between 41 and 60 years who lives in Pottawatomie County and recently traveled to California. All 5 are recovering at home in isolation. The Iowa Department of Public Health has begun its full case investigation, which includes reaching out to the others that had contact with affected individuals before they were diagnosed. We also are aware of 22 Iowans who have been quarantined on the Grand Princess cruise ship where an outbreak of coronavirus has occurred. 18 will be returning home soon on a chartered flight, and they are not symptomatic at this time. DPH is now working with the appropriate agencies to prepare for their return home. They have requested they be screened before traveling back to Iowa, and they will also be setting up a screening center for when they arrive. The 18 live in various communities in Iowa, and additional travel will be coordinated so they can be quarantined at home. The reality is COVID-19 is now here, and we can expect the number of tests and the number of positive cases will continue to increase in the days to come. While this news is concerning, it's not cause for alarm. I want to assure Iowans that we are prepared and we are taking additional steps to ensure access to resources to effectively manage the situation. Yesterday, I signed a proclamation of disaster emergency activating the Iowa Department of Homeland Security's Emergency Response Plan, and this authorizes state agencies to use resources, including personnel, equipment, and facilities to do what's necessary to prevent, contain, and mitigate the COVID-19 virus. This weekend, the State Emergency Operations Center, or SEOC, was officially opened for Iowa COVID-19 response. Directors and other leaders from all state agencies met yesterday to address a variety of issues from mitigating community spreading to adjusting business practices when the situation warrants. While SEOC was meeting, while they were meeting yesterday, I joined other governors from across this country for a teleconference with Vice President Pence and the Coronavirus Task Force to discuss the latest developments at the federal level. I want to thank the President and his administration for their commitment to the American people during this time. Yesterday, we were on the meeting, we were updated about meetings between the President and the Vice President that they have had with executives from nursing facilities, air and cruise lines, pharmaceutical companies, hospitals, and as well as the insurance industry. We were also briefed by HHS Secretary Azar, CMS Administrator Seema Verma, as well as leading infectious disease experts. And what I heard from my colleagues from other states is that we are now experiencing is consistent with what's happening across the country. The number of tests and positive cases will continue to rise. Community spread is going to continue to increase. We are moving from prevention phase to mitigation. Children and younger adults are at a lower risk. In fact, there is a lower mortality rate with coronavirus as compared to the flu. Seniors with chronic underlying conditions are at the highest risk. The best thing to do, again, is to remain calm, stay informed, and do your part to reduce risk by washing hands, covering coughs and sneezes, not touching your face and your mouth, to stay home, and most importantly, just to stay home when you are sick. If you are sick and have a fever, cough, or shortness of breath, contact your doctor, but call first. Your doctor can assess your symptoms and situation over the phone and then determine whether you need to come in, and this, again, will help prevent the spread of the illness. You can also call the Department of Public Health Hotline 211. The phone line is open 24 hours a day, 7 days a week, and they are more than willing to answer any questions that you may have about the coronavirus. It's very important to know that if you or a loved one is an older adult or has underlying health conditions, you are most at risk. You should take additional precautions to protect yourself. Be mindful of your activities, avoid large crowds when possible, and carefully consider whether travel is necessary, especially if it takes you to areas known to have the COVID-19 virus. So we're not suggesting that you stay home and stop your normal routine, but we are urging all Iowans to be responsible about your health and the health of others. And finally, I want to reassure Iowans who are worried about their ability to pay for coronavirus testing if it's necessary. I want to let you know that all major insurance companies in Iowa have agreed to waive the cost share and copay for the testing, and that includes Medicaid, Medicare, Wellmark, Aetna, Medica, as well as United. And members of these plans also have access to telehealth visits, again, that will help get your questions answered without leaving home until we have confirmed whether further actions are needed. So if you have symptoms like cough, fever, shortness of breath, please contact your doctor and get care. And to talk more about how every Iowan can help prevent and contain the COVID-19 virus, I'd like to ask again Dr. Padati to say a few words. And I would just like to, before I turn the podium over, just thank a heartfelt thanks to the individuals standing behind me who are working tirelessly with their team to get the information out, to make sure they have the latest information and updates, and to do everything that they can to contain the virus. So I just want to thank you for all the work that you guys are doing.
Thank you, Governor Reynolds. So I want to start again by saying that we wish the affected individuals here in Iowa a fast recovery, and local and state public health are going to continue to support them and their communities in the coming days. I know that as our case numbers increase, concerns may increase as well. And I want to emphasize what you've heard from Governor Reynolds, that in part, most of our new cases were identified through a targeted investigation by our local and state public health disease detectives, which is exactly why we do this work. And I want to take a few moments today to describe for you a bit more about that work and what that means. So our disease detectives follow up on a variety of conditions with public health importance, and we do this with two goals in mind. One is that whenever possible, we want to try and understand how someone has become sick. But the second, and in some ways more important reason we do this, is because we want to identify whether there are any other people in the public who would need to know anything to help protect their health. We refer to this as implementing public health control measures, and so that can mean a variety of things depending on the illness we're talking about. Sometimes that means offering a medication or a vaccine, and when those tools aren't available, we have other public health tools, which are things like advising people to stay home and providing support by having public health monitor to help these people keep track of their symptoms and how they're doing. So we also want to emphasize, when we recognize these kinds of illnesses, some of the advice that we give is to stay home, and that's really important because the more things we can do to reduce personal interactions, especially as you heard from the governor with people in those high-risk groups, the better. Typically, these kinds of public health investigations can range from a couple of hours to a couple of days as we gather that kind of information. We're very grateful to all of the Iowans who might have been called by public health over the years to help us do this work, and there are likely many of you who've heard from us, and we appreciate when you work with us. We're going to continue to do that kind of work, forever. That's sort of what public health does. We also want to sort of make sure that you understand the experience so far with COVID-19 is indicating that there's probably a majority of individuals who might have mild illness, and it's our older adults and those with underlying conditions who seem to be at higher risk of severe illness. And I think that's really important to keep in mind as you hear the advice that we give, because what we're recommending, again, even though it sounds basic, those steps of washing your hands with soap and water for 20 seconds, of really staying home and away from those high-risk groups in particular when you're sick, are going to be effective at limiting the spread of viruses, whether we talk about COVID-19 or flu or other illnesses. Again, I want to recognize that anytime there's something new or unusual and a lot of information is coming out, it can be hard to keep up. Again, I want to reiterate that you can refer to the public health webpage as well as our 211 line for additional information. And we want to encourage Iowans to stay informed, to wash their hands and cover their coughs, and to truly stay home when they're sick. Thank you.
With that, we'll open it up for questions.
So when you talked about you have to kind of balance the public's need versus the privacy of these individuals, is it not relevant to share how these folks, especially those who went on the Egyptian cruise, to come back to whether they flew into Cedar Rapids or Des Moines or however they came back? Does the public need to know that in case they encountered any of these folks?
Well, I can maybe have Dr. Fadati answer that, but that's what they're doing through the assessment, is they're asking the questions about who they've been in contact with, have they gone to any public events, and so that's part of the assessment that Dr. Fadati talked about. And they reach out to each one of the individuals, do the assessment, and then make the recommendations from there, and that's how we update the public.
What's the time frame on that? Because they've been back for several weeks.
Well, we've asked them to self-isolate, so we identified immediately. We asked them to self-isolate. Some have been tested. I believe 10 are pending as they continue to reach out to them and gather information so we can continue to assess if more additional steps need to be taken. But that's part of the process. It is a fluid situation. We're learning every day as we have, as the cases rise, you're going to have more people testing, and we're going to have more negatives, but we're going to have more positives. And that's when we'll start to make the decision. Right now, it doesn't appear to be that it's community spread taking place, but as they're asking the questions and gathering information, that's what we're trying to discover. Is there anything that I need to add to that?
No, I think I think you're asking very logical questions. Again, these are part of public health investigations that we do, whether we're talking about measles or whether we're talking about pertussis or any of the public health illnesses, of significance, right? And we have a way of asking those questions and assessing those kinds of exposures. We reach out to the relevant parties, when we need to do that. And I think it's also important to keep in mind two other things. This virus is really transmitted by droplets, right? So we can, again, sort of use flu as a metric for that. And what that means, right, is, we really have to be sort of in pretty close proximity with somebody who's coughing, sneezing, and those droplets get in the eyes, mouth, and nose of someone else. And that's why it's so important, right? And I know it sounds basic, but if you wash your hands, you get that germ off your hands, right? And if you remove yourself when you're sick, then you're not around other people. So I think that's part of, one thing to keep in mind. And I think, again, the other thing to keep in mind is that regardless of whether we talk about COVID-19, whether we talk about flu, or any of the other respiratory viruses that circulate this time of year, the advice to keep an eye on your symptoms and your family members' symptoms. And if you become sick, to stay home, that's always good advice. We're going to give that, every part of the year, no matter what.
Do you have any idea, did they come back contagious, or does it take a while for this to kick in?
Those are all the questions that we ask. So we ask about, when you've started having symptoms and that sort of thing, and that's how we come up with, the relevant people that we need to reach out to.
But what's the answer in this case? I mean, how did they get from the cruise to Iowa? Did they come through public airports before they checked in with their health providers? Did they go to the grocery store and intermingle with the public? That's kind of the information the public wants to know. They don't want to know, yes, they've been assessed.
Yeah.
What would the assessments reveal?
No, I understand the question. And I would echo the governor in saying, again, we always balance, respect and privacy of individuals with sharing information that the public needs to know to act on to protect their health. And so, again, as we learn more, if there are important messages that we need to share, we'll certainly do that. We've done that in the past, and we'll continue to do that.
Right now, that information isn't being shared, correct?
Right now, there's not any kind of public notification that the public needs to be aware of. Correct.
What is the justification for that?
About that case, there's a case in which someone was worked at a restaurant. Is there any information you can share that would enlighten you?
Yeah, we're definitely aware of those reports, and again, this is part of the process that we go through when we talk about these kinds of investigations. And we ask a lot of questions, again, about, when did you start getting sick, and what types of activities did you do, and all of those things are important in helping us understand individuals that we need to reach out to, and whether or not we need to share broader announcements. And again, those are things that we've done in the past, for whether it's a respiratory illness, whether it's a foodborne, vehicle, we want to make sure we make people aware when there's something they need to know. But the primary message that we really want people to understand truly, it's going to become more and more important in general. Wash your hands, cover your cough, and stay home when you're sick. That's really what the ultimate important message and action to take is.
So if you're not sharing further information about that, can we just assume that there's not a community need for people to
Yes,
know?
yes, correct. Yeah.
Governor, you mentioned, addressing issues as the situation warrants.
Yep.
How will you know when the situation warrants more aggressive containment measures such as closing schools?
Yep.
Canceling major public gatherings? When will you know that the situation?
Well, every day we're assessing that through the assessment that the Department of Public Health is doing. That starts to put, it kind of gives us a good overview of where we're at with COVID-19. What is happening? How are we containing the spread? What is it tied back to? Is it isolated to this case? Have they been out at any major events? We also have individuals that are making those decisions. I would encourage schools and businesses. The Department of Public Health have done webinars. They put out information sheets. They have put out all kinds of information for schools and businesses and public health facilities to kind of walk through helping them make those decisions. And so right now, if you're trying to decide if you should or shouldn't, I would encourage them to call the Department of Public Health, walk through again some of the things that they look for, some of the questions they're asking, and whether it's necessary to take that next step. Right now, I think what the doctor is saying, and Rod, to your question too, they are evaluating this situation. They are taking all of that into context and making the recommendations to make sure that we're protecting the health of the public moving forward.
Do you get involved in any of those decisions? Because there's a cost either way, right? There's
Yep,
a cost
yep,
in acting too
yep.
soon. There's a cost in
That's,
waiting too long.
it's another reason that we stood up the SEOC. It's another reason that we have daily reports. We're working very closely with the team behind me. We're all engaged. We have all of our state agencies. We're doing outreach. We talked about one of our main focus was on long-term care facilities and nursing homes because it is such a vulnerable population. The department is almost complete in reaching out to all 400 to make sure that they have standards and protocols, and they're putting in place maybe visitation limitations and just doing some of the things that they need to do to make sure that they're really evaluating what the situation looks like and making appropriate decisions based on the data and the recommendations that they have. I will be meeting later today with the Hospital Association as well as the Nursing Home Association again so that we can sit around a table, talk about the latest information that we have, what are some of the standards we're using, see if it aligns with what they're doing, and just to have that conversation to see if there's additional things that practices and procedures that we need to put in place. But this happens, this is going on all the time. Throughout the day, on the hour, these conversations are taking place.
Can you tell us about the 18 who are coming back from the cruise ship? Are they self-isolating at home, or were they isolated on the ship?
They're both. So they're asking for them to, so we're still working through some of those details. We are working with General Correll with as well, but we are asking that they have an assessment done before they board the chartered plane to come back home. We're asking that they do an assessment once they get here, and then we will, I think the plan is to maybe then have them self-isolate for 14 days just to make sure that we're taking all precautions that we can. But Kay, we're still working through some of those details, but they will be finalized before they come back home.
Governor, does that include self-isolation for individuals that live in that household as well? And what is the state tracking in terms of sharing information about people who are in self-isolation? And I know that is sometimes used with quarantine.
Yeah.
Just making sure those definitions are clear.
Yeah, those are great questions. So again, the part of the process will be to do an assessment of individuals and make sure that we're meeting both clinical needs and public health safety. That's sort of always the two things we do together. And you're right, when we talk about self-monitoring, we're talking about the traditional public health word of quarantine, which means somebody who's healthy but who had an exposure. And we work with you to come up with, well, when was your last potential exposure, to calculate based on the incubation period how long we'd ask you to be away from other people. And as long as these people don't have symptoms, we provide them with guidance, we check in with them twice a day, but the other people in a household can move about and have their sort of normal routines.
So just to reiterate, if someone, to kind of follow Rod's point of these people who are coming back, they're public airports, going to the grocery store, they're not showing symptoms at the time, is that fair to say that they're not spreading it to other people? It's only when people are symptomatic?
Yeah, everything that we've seen so far, we think you're most contagious when you have symptoms, and that's exactly why, and again, I know I've said this many times, and it sounds overly simplistic, but paying attention to symptoms and having people who feel ill stay home, whether you think you have flu or anything else, is really an important and really effective thing to do.
Is the state changing its strategy in terms of testing? Because before you were saying that you're encouraging clinicians who have patients with a travel history to reach out to the Department of Public Health. Is it still just patients with a travel history? It's been spreading in the U.S. now, so have you changed your advice to clinicians? Or?
We've broadened it out. Do you want to add more to that? I think they've broadened to their testing.
I would just,
Yeah.
we have changed, and that's appropriate. We change as the situation changes. We're going to continue to do that. Again, we're very fortunate to have a great community of clinicians and public health professionals in this state. We work with them, and as people have concerns, we want to hear about those. We stay in very close contact with our neighbors in other regions, other states, and at the federal level. So we adjust as we move along. And again, there's always a balance, I think, between clinically what a patient needs and public health, reasons, what a person needs. And so, we're going to keep those two priorities in mind as we adjust going forward.
Can you talk a little bit about the state's resources in terms of contact tracing? Because it's one, meaning, kind of retracing the steps of these individuals. So if you have a situation where it's just 3 cases, that's still a lot of work. And if you get to a point where there's a lot of cases, at what point does the state have the resources to do that type of work? And when do you stop doing that type of work and try other mitigation efforts?
Well, we that's one of the reasons that I signed the disaster proclamation yesterday, to free up some of those resources, not only personnel but equipment, and to be able to implement the team to do the necessary work. But in addition to that, with the supplemental that was signed at the federal level on the call yesterday with the vice president, they're anticipating getting that out, or really required to get that out within the next 30 days. And so we will receive funding coming into the state by April, 1st of April, I think, middle of April. So they understand that that's an issue that states could be dealing with, and through the supplemental that was passed and signed by the president, they are to allocate a sum of the funding to the states by April, mid-April.
Some states, including Minnesota, have signed their own state legislature supplemental aid for this specifically. Have you given any thought of perhaps the legislature needs to tap into emergency funds at some point?
No, but we have them available if we need to, and that's something that we can, again, was the cost that we sent to the federal government as they were trying to put, to figure out what the overall cost would be. And so, of course, we're not getting all of that, but we've got a pretty good chunk. I can't remember, I can get that to you all later, how much they anticipate the first round coming into the states, but it'll be very helpful. And then we just have to continue to assess and see, as this evolves, what the need is, and we'll have a legislature that'll be willing to step up if it becomes necessary.
Do you hear from any hourly workers from
Well, it's our message to the employers to make sure that their employees know that if they're sick, they need to stay home. As you've heard Dr. Padati say over and over and over, one of the biggest things that we can do to contain and mitigate is to stay home if you're sick. And so make sure that your employees feel confident in being able to stay home. That's problematic sometimes with some of the service agencies, but I know on the conference call yesterday that we had with Vice President and the task force, the administration is looking at some type of economic relief. I think incentives, maybe a payroll tax relief, so they are addressing that, or I believe even today may be addressing that situation. So, we don't expect people that are doing the right thing to not, get a check, and so we are anticipating them addressing that at the federal level today, and then we'll just see what else we need to do.
The individual in Potawatomi was tested in Nebraska. Can you talk about the coordination between border states? So maybe perhaps even in eastern Iowa, maybe it'll be Illinois or Minnesota. What that coordination looks like?
Yeah, again, our relationships with those other states and other jurisdictions exist and have for a while, both at the local and at the state level, and we continue to rely on those. We speak together in regular contact, and we do that through a variety of disciplines, not just epidemiologist to epidemiologist or public health to public health, emergency manager to emergency manager, laboratorian to laboratorian, and it's in part why we make use of things like our incident command structure that helps coordinate some of that communication, and the work that we do, through the SEOC and other things to help coordinate those relationships.
What is your plan moving forward in terms of keeping the public informed, because these numbers are
Oh, yeah.
could be changing by the minute?
Yeah. So, and I've made the commitment to keep the public informed. And so I think when we think about the timing of the test coming in and when we get the results and when we start to do the assessment, you can count on an update from the office and from Department of Public Health anywhere between the 5:30 and 6 o'clock time frame. I think if we're consistent, then you all will know when to expect any update on cases and any additional information that we may have. So that's the plan right now. But if we need to do another press conference or do anything, that's to keep the public updated, we will not be hesitant to do that. So I think the more that we can keep the public informed and updated and educated and keep saying over and over, if you're sick, stay home, here's the precautions that you need to be taking, that's helpful. So we're going to be doing everything we can to continue to get that message out.
Governor, could you talk a little bit about the testing capability of the state? Right now, it's still about 500.
Yeah.
Obviously, these cases, there's
Yeah.
more testing being
Yeah.
done, so what is the timeline there?
And they addressed that yesterday on that. We had 500, so out of the 51 total, we'll have to take that off, but we're in a good place, and they addressed that on the conference call yesterday. They've allocated $1 million. They think it'll be 3 by that. So they're continuing to increase the number of test kits that are being allocated across the state. And then I think as commercial testing is able to be brought on board, then that's also going to alleviate some of the concerns. So right now, I have no concerns with the number of
You said we're in
tests.
a good place. Do you mean the state of Iowa is in a good place with,
Yep.
with the 500 tests?
Yep.
Do you have a timetable for when we'll have 1,000?
No, because I have no idea but I'm saying right now, we feel confident with what we have. As we bring the commercial test on board, then we'll there'll be more available at that time. And on the call yesterday with the vice president, they had indicated the capacity is increasing basically daily on the number of tests that they'll be able to allocate to states across the country.
Dr. Panati, yesterday, federal officials recommended that all Medicaid and Medicare patients be screened. How does that work? The majority of Iowans are part of those two groups.
Yeah, I'm not quite familiar with that recommendation. It's something that we can take a look at and follow up with you on. I think, again, our priority is always going to be making sure we do what's clinically appropriate and public health safe-wise for all Iowans, and so we can get back to you on that.
Governor,
I'm not aware of that.
have you given any thought to the length of legislative session? I know we talked to leaders upstairs. I think they're following your lead.
Yeah.
Obviously, no need to call it
Right.
yet, but have you given any thought to?
No, we'll assess every day as we, take a look at where we're at and what we need to do right now. I think the same practices apply to us, to the legislators. If you're sick, stay home, don't come in. But right now, if people are coming to the Capitol, if they don't feel well, stay home. So right now, I don't see any need to address that. Those are things, though, that we'll have to take a look at depending on what happens in the days ahead.
Has there been any consideration of canceling large gatherings here at the State House or, the Farm Bureau guys before coming in today?
Yeah. Again, people need to, they need to be responsible for themselves and to stay home if they're sick. Do the simple matters. Wash your hands if you've got a fever or a cold or any respiratory issues. Stay home. Call the doctor. Get assessed. So, no, right now, we're just, but we'll monitor. It is a fluid situation, so that could change moving forward. But right now, we're not anticipating making any changes.
Governor, you got time for one more question. 22 Iowans were the Great Princess, right? Which is 18 of them are coming back.
Yeah, they are not traveling back to Iowa. They're going other places.
Are any of them those who are showing symptoms?
I don't believe so, but again, I don't believe so, but again, there's a process that we have in place sort of both at that point and we're working with the partners sort of in California and then processes as you move into other states. And it's another example of a place where, again, we work very closely with other states.
That's what I was going to say. All states are implementing the same practices. So we've had almost all governors participate in the calls. We're doing a national governor's call to talk about what states are doing so that we can coordinate our efforts. So every single state that's experiencing this are putting in similar protocols for people coming in and out of the state. Thank you.